listening to EMS with your hosts, Erik Axene and Matt Ball.
You know, I was glad you texted me last night.
Yeah.
I wasn't able to watch Monday Night Football last night. I usually try to watch it. But.
Yeah, us too. Yeah, I was at the station last night, and we were watching something else, and one of the guys I work with was like, hey, did you guys see this? And kind of came up and showed us the video, and he said they did CPR on the guy. I was like, whoa, that's unusual. And so obviously I thought about, because we actually started talking about it, and I remember back from paramedic school them talking about, you know, getting a sudden blunt trauma to your chest can cause somebody to go into cardiac arrest. But I thought, well, heck, I know a guy that might know about this who's not just a physician, but actually an NFL sideline physician.
Correct.
So tell me a little bit about that. I don't know anything about an NFL. What do you do?
Well, we'll get into some of the details of cardiac arrest and some of the causes for it. One of the causes is blunt chest trauma.
Yeah.
If it's done at the right location at the right time during the cardiac cycle. But,
right.
I'm called an airway management physician. And so what we'll do is we'll, as we've talked about before, if there was a need to establish an airway in one of the football players, whether it's the home team, the Dallas Cowboys, or the away team, the visiting team, we would be on field as an expert capable of getting that airway.
Okay.
You know, you can't live long without food. You
Right.
can't live long without water.
Yeah.
But you can't live more than a few minutes without air. So the airway is a very important skill to be able to able to be successful at. If somebody isn't able to get an airway in a patient that needs it, they could die in minutes.
Yeah,
right. So anyway, so the NFL has created a position called the airway management physician, and at every home game, the home team has to furnish that airway expert.
And why do they call it an airway? Why is it airway? Like, is that all you're doing is airway?
No, good question. Yeah, these are great questions you're asking. I have family and
I've
friends
always
always ask me this.
Yeah.
So I am called an airway management physician, and that is one of the primary reasons why I am there, is the establishing an airway.
Okay.
If there was a catastrophic event like what happened last night,
Right.
Getting an airway is one of the first things that we'll do.
Gotcha.
One of the first things.
Yeah.
But one of the other things that I'm responsible for as well, if I'm the airway management physician at that game, is orchestrating and working with my paramedics to handle the cardiac arrest situation.
Okay.
So my primary role within working a patient with cardiac arrest will be the airway.
Sure.
And then one of my lead paramedics will help with timing and assigning roles.
Right.
And we orchestrate it and practice it before the season starts.
Okay.
So we're ready to go.
Yeah.
And this is a much different situation than a typical football injury.
Yeah. So, and I was wondering about that. Again, I knew you worked for the NFL, but we've never really talked in detail. So, I'm curious. Like, obviously players go down all the time. Knee injury, or they get the wind knocked out of them. I'm assuming that it's initially like trainers for the team that kind of come and initially check the patient. Is that right?
Actually, it's a paramedic. It's the first one.
Oh, the guys that aren't. Really?
Well, I mean, I'll explain. So we, when there's an injury on the field, we all stand in our areas. The trainers and the physicians that work with the team, the orthopedic surgeons and the neurosurgeons, they're usually standing within the team on the sidelines, and they can be anywhere. Okay. Whereas if you wanted to find me, I'll be on somewhere between the 25 and the 30-yard line, carrying a backpack with my airway gear in it.
Oh, okay.
And then standing with me is my lead paramedic. And so if there's any sort of an injury on the field, my lead paramedic will go out onto the field to see if it's the type of an injury where I need to come out there.
And so the lead paramedic, he's like a local paramedic, or is this hired by the NFL, or somebody you pick, or how does that work?
Good question. Yeah, no, we work with private EMS agencies. We also work with local fire departments to provide emergency medical services for the game.
Got it.
And the care given there under my medical license will help to save patients' lives. And if it's a professional athlete that gets injured, the lead paramedic, as well as the athletic trainer and some other physicians that work for the team, will go out there, and it doesn't take long to identify the fact that there's something really wrong.
Right, like last night.
Like last night.
Yeah.
So in the past, we've had hand signals. There was a few seasons back we used earpieces, and we would communicate with one another. But the communication's key there in identifying a life-threatening emergency, where they would need the ER physician, myself, to go out there and take over and to deliver the life-saving care.
So every time a player goes down, regardless of, whatever it is, every single time a player goes down, a paramedic is part of the group that comes out to see is this beyond just a minor.
This is how the Dallas Cowboys do it.
Okay.
They will, the paramedic, my lead paramedic, will go out there. He's standing on the sideline with me. And then the athletic trainer for the Dallas Cowboys, or maybe the other team or whatever, they'll send out their staff as well. So there's a team of people out there.
Yeah, right.
But I usually don't go out there for just the basic injury. Sometimes if it looks like a particularly gruesome injury, sometimes I'll walk out onto the field just to be ready. But most of the time, I'm just standing on the sideline with the team, waiting to see if I'm needed or not.
But that's interesting that they have a paramedic going out there to see if this is like last night. Is this something beyond the normal, like knee injury? I just figured it was a couple of trainers going out there to see what was going on. I didn't realize that.
See, it's different in each stadium,
right?
And the visiting teams that come out, they'll see the way we do things, and they'll comment on how it might be different than another stadium where they visited. So in Dallas, this is the way we do it. And we work closely with the paramedics.
Sure.
We work closely with the athletic training staff on the team, both teams.
Right.
And then we work closely with our physicians as well. Now we work closely with the referees as well. We have meetings before the game with the medical staff from the visiting team, the home team, the referees. I mean, we have a number of different set meetings at a certain time before kickoff. And so there's quite a bit of communication and meeting and planning, preparation that goes into the game. But most injuries, though, are usually orthopedic injuries, a hurt knee or an ankle or a neck, maybe.
Well, and I think that's why people were so shocked last night. I mean, you're talking about a 24-year-old professional athlete. I mean, probably one of the fittest people on earth going down, and the hit didn't even look.
Like a normal hit.
Yeah, it looked like a normal hit. There wasn't anything that you would look at that hit and go, "Oh my gosh, that guy's in bad shape," until he got up.
That's right. Well, And I think this is what all airway management physicians across the NFL fear, is something like this happening.
Right.
And I don't mean fear in that we're afraid of it.
But
it's just that this is what, as an ER physician...
It's the worst possible
situation. And my mantra
is
to be prepared for the worst. I always hope for the best, but I prepare for the worst.
That's our job. Yeah. That's our jobs. So the hit didn't look overly impressive, and then obviously he got up, and I think even a layperson could tell the way that he got up, and then the way that he collapsed was not just a normal thing.
That's not good.
No.
That my blood pressure would have gone up, and I'd have been running out onto the field.
So that would have cued you, just knowing what you know.
Well, we've never been in that situation, but we practice it.
Sure.
And then when we practice it, we're hightailing it out there because seconds matter with these types of things.
Yeah.
So, with this particular incident with Mr. Hamlin on the Buffalo Bills, the staff there, they responded immediately from what I've read, and they were on the field for close to 10 minutes, I think, getting that heart started again.
Yeah.
Now, most people don't know this, but in Hollywood, when someone goes into cardiac arrest, it's like 99% successful.
Hollywood.
But the reverse is actually true. A very small percentage of people that go into cardiac arrest actually survive to hospital discharge.
Yeah, exactly. Getting the pulse back isn't, exactly.
But the cool thing about what happened last night, which is, we've talked about this before in our cardiac arrest lectures we've done for ACE, is that bystander CPR, having somebody start the CPR right away, improves survival dramatically. The slope of death, right? So
flattens that curve and that slope of death. It's 10% every minute. Your survivability decreases by 10%.
That's correct.
And as soon as you start compressions, that line starts to level off.
That's right.
So I would think he got, obviously I didn't see it live, so I don't know how fast, but I'm assuming he probably had chest compression started within 2 minutes.
Less than a minute, I would say.
Yeah, okay, even that fast.
Because I know the footage I've seen of him, the action started just seconds after he had collapsed.
They realized what was going on.
So I would say that there was somebody on that chest after having found him pulseless, getting the chest compressions going.
We were talking about this too. Kind of a side note, the shoulder pads.
Yeah.
Doing chest compressions with did they remove those?
Well, see, that's part of what we could spend a whole lecture on.
I'm
this.
sure. Yeah.
No, it's kind of cool. I mean, this is part of what I enjoy.
Yeah.
We actually work with our paramedics, and we work with the athletic training staff for the Dallas Cowboys, and we work with our physicians, and there's a group of us sideline physicians. It's not just me. We have there's a few of us there that we work together and share the games, but we all train together, and we actually orchestrate how we would go about doing this. And there's a group that we work with. I can't remember their name, but it's all evidence based. And the way we remove a helmet, the way we remove the pads and the jersey, it's all very quick and practiced.
Yeah.
So from the quick release bolts and the helmet face mask.
Right. And you've got all the equipment people there. I mean,
exactly.
It's a perfect situation.
So we get in there pretty quick to take care of all the equipment. That's a great question. And that's an important part of it because these patients are unique.
Oh, super unique. Super healthy, though, which is good.
True. They're usually healthy.
Yeah.
Usually healthy, and there are medical problems, obviously, everywhere. But these guys, by and large, are large, muscular, very healthy guys that are going into cardiac arrest. It's not like they're just sitting on the couch.
Right.
These guys are exerting themselves, so I'm sure his heart rate was pretty high.
Sure.
And but these guys are very fit and healthy, and they're usually very large. And the amount of medication they may require for various things could be quite a bit different than the regular population.
Lay person, yeah.
But let's talk a little bit more about what's going on with what could have happened.
Yeah, that was what I was going to ask. Is there's been obviously nobody knows for sure, right? Exactly what happened at this point.
No.
But what is the general opinion of what they think happened?
Well, let me say this first. Is that when you and I talked, we wanted to get this podcast out quick.
Yes.
There's a lot of information coming out, and I am communicating with some of the physicians who are closer, and I can't give away a lot of that information. But the one thing I will say, though, is that what likely had happened, and what's really important to us to talk about is this concept of commotio cordis, where blunt chest trauma can interfere with the way that the heart beats. And so our viewers, maybe a paramedic working a blunt chest trauma in a car accident.
Yeah.
You find that patient in asystole.
Yep.
Chances of survival are not so good.
0, yeah.
You see PEA or some sort of an electrical activity or pulses or whatever. The chances of survival are much better.
Yeah.
And so we work these patients differently. Now, what happened on the field last night was there was energy transferred to the patient's heart from that impact, that blunt chest trauma. Now, with commotio cordis, they've studied this. It's very interesting. And I don't want to geek out too much. You know me. But if you hit over the heart, the precordial area, and you interfere with that left ventricle,
right,
with the energy transferred through the chest wall into the heart, at the right time, you can create life-threatening heart rhythms, and you don't want that.
Yeah, right.
So it's the location, getting hit in the chest, and then the timing within the cardiac cycle. And we talked about it on the TikTok we did this morning, with that right before the peak of the T wave, between 10 and 30 milliseconds before that, there's this period we call the danger zone, where if you have that cardiac impact in that danger zone, you could potentially go into ventricular fibrillation, which is not a perfusing rhythm.
No, we all know that.
So
one of the things I thought was interesting too was a lot of people had commented about how he took the hit. They went to the ground obviously, and then he stood back up. And one of the things that I heard was that once a patient goes into full cardiac arrest and they are no longer producing a blood pressure, they are no longer producing a pulse, it takes about 6 seconds for the brain to lose enough oxygen or perfusion to where they actually start to lose consciousness. And we were looking at the video and we counted, and it was about 5 seconds from the time he got the hit to when he stood up and then collapsed and went unconscious, which kind of fits the whole hit picture.
There are a couple interesting factors at play here, which is kind of cool to think about. Now, we talked a lot about cellular physiology and how you bring fuel to the cell, and the cell uses oxygen and all that stuff, and releases waste product. Anyway, But when a cell has that energy, now the brain cells are super hungry for glucose and oxygen.
Yeah.
And at the moment of impact, blood had been delivered to those cells, and it's going to take a few seconds for them to feel that deficit of, nothing's being delivered.
Yeah.
So there's that.
Yeah.
But there's also this interesting thing, too, with healthy blood vessels. And these young I think Mr. Hamlin's 24.
I believe so, yeah.
Very young, and gosh, I'm old enough to be his dad, which is crazy. But anyway, I'm actually double his age. I'm 48. But if you compared his blood vessels to an 80-year-old's blood vessels, a 24-year-old guy like Mr. Hamlin is going to have very elastic blood vessels.
Right.
So when he has that blood, the heart beats and fills up those blood vessels. After the heart stops beating, there's some elasticity that continues to generate a pressure.
Yeah.
So even after that first heartbeat, you still get a little bit of pressure after for that second or so. Because if a healthy guy, a heart rate of 60, that's a beat every second, right?
Yep.
So you've got that period between beats that maintains. So you've got that as well.
Yeah.
And then you've got the delay of the cellular physiology of using up the fuel that had been delivered.
Yep.
So I think that's where that delay comes from.
Gotcha.
But what's interesting about NFL athletes, and we talked about this earlier, is that they're so metabolically active, functioning at such a high level in an extreme exertion, that these guys are actually extremely susceptible to brain injury because they're burning through the fuel so fast.
Oh, okay.
Because Mr. Hamlin is in the middle of a professional football game, exerting
burning
himself.
A tremendous amount of fuel, oxygen, everything.
One thing I didn't think about until right now is I wonder how many plays he had been.
It was early in the game. I think it was first quarter.
And if I remember correctly, it doesn't really matter right now, but had he been on the field a long time, was he particularly tired and fatigued?
Yeah.
That could actually play into the risk for anoxic brain injury if he was exerting himself and really kind of at the razor's edge of exhaustion. Mm-hmm. If you go into cardiac arrest at that point, you're more susceptible to damage to cells.
Because you don't have reserves.
That's right.
Kinda, yeah.
If I went into cardiac arrest right now at my baseline, just sitting here talking to you, I would have more bandwidth or there'd be more flexibility in getting me back without any injury, just because my metabolic rate and my demand of oxygen is lower.
Right.
The demand for oxygen is so high in these athletes on the field that if they go into cardiac arrest, they have less time.
Yeah.
So even the seconds that it took to get out there, those seconds would be much more crucial than it would be for somebody like you and me sitting here right now.
Interesting.
So these are a very unique population of patients and somebody we care deeply about. And even though it wasn't a Dallas Cowboy or the visiting team that I would be caring for, it just really broke my heart to see what had happened, only because I touched these things so closely that when I heard about what had gone on and watched the pictures, my heart just sank. I mean, I feel like tear ducts welling up, just hurting for them. I've had an opportunity to meet a number of these professional athletes. They've got families. They
just
they
people
hurt
like
just
we
like
are.
you, and
absolutely.
they're wonderful people. And they are so dependent upon their functionality as a physical specimen that these sorts of physical problems and diseases and emergencies, I think, hit them even harder. Only because their livelihood is based on their physical ability to perform. And I really believe, I felt it to a certain extent, just seeing the mortality of a young 24-year-old healthy specimen athlete have something like this happen. I think those athletes on the field were really, they feel it in a way that's hard to describe, only because they are so healthy. And to see their comrade fall like that, really, I think is tough to watch.
Oh, absolutely. Brotherhood of the NFL. I'm sure those guys, like being in the military or the fire service, super, super tight. A lot of those guys were, obviously shaken up last night. So we talked a little bit about what the pathophysiology, basically, of what we think happened last night. Obviously, none of us know for sure. So from an ER doctor, I think there's a couple of takeaways. Number one, the importance of bystander CPR. Like if people don't know how to do, you know, it's hands-only CPR now. You don't have to open airways. You're not having to do mouth-to-mouth. People don't want to put their mouths on anybody that they don't know anyway, and I don't blame them. But doing those chest compressions early is huge, huge. And then for EMTs, first responders, paramedics, firefighters, you respond to a stadium at a high school or a college or even a young driver in a car. And something like this happens and you're thinking, golly, why would this young, healthy player go? Doesn't have to be a football player. Really doesn't, I don't think the treatment changes as much. No. Chest compressions, early defibrillation is probably going to be the key. It's restarting that heart. Yep. You get it restarted. It's not really a pump problem. He's probably going to start pumping fine right away.
Well, it's interesting you mentioned that. I won't geek out on it too long, but the studies that were done to try to understand commotio cordis a little bit more were done on pigs.
Okay.
And a lot of the fear initially with commotio cordis was on the baseball players. Having a baseball hit you directly in the chest. There's no padding in a baseball jersey. Right. It's the ball versus your chest wall.
That's true.
And that energy being transferred real easily to the heart could potentially put a baseball player into cardiac arrest. And that was the concern. Mm-hmm. And so when they studied these pigs, they actually would shoot some sort of a projectile the size of a baseball, and I think that was actually made of wood, but into the pig's precordial area to see what would happen. And they studied these pigs. And the rhythm that they would go into, that was the most common life-threatening rhythm they would go into, with a baseball-sized projectile at 40 miles per hour, was ventricular fibrillation. But the interesting thing is that there were other rhythms they went into as well. It's not just VFib. Oh, there were heart block, bundle blocks. I mean, they would go into other things too.
Now, did that depend on the timing of the cardiac cycle when it hit?
Well, that's the other thing. So it's not just the area where you get hit. We mentioned the danger zone, the 30 milliseconds before the peak of the T wave. Yeah. If you get hit during that danger zone, you're highly susceptible for potential VFib, right? But even outside of that little window, you get hit hard enough. There were other rhythms they would go into, even VFib, at other points in the cardiac cycle. Okay. Now here's where things get a little controversial to me, and I say this out of respect to the Hamlin family.
Absolutely.
And this is just me as a physician looking at the footage probably 100 times now. Is based on the data that we saw in studying commotio cordis. It was, the projectiles, going 40 miles an hour or greater. And then they studied actually padded or softer projectiles, and the percentage of the time that they would trigger a bad cardiac rhythm was much lower. And as I watched the footage, it wasn't like a helmet straight into the chest. Right. It was like a shoulder into the chest, and it was a violent.
Oh sure,
hit.
All their hits are violent.
Oh yeah, and you see the head knocked back and knocked to the ground. Honestly, it didn't look. I mean, it's a bad hit. I mean, it looked like the type of hits we see.
But it certainly didn't look like something where you're like, oh my gosh, this guy is in bad shape initially.
So I wonder, actually, because of the way that the shoulder, was the primary impact site, which is, spreads out the
disperses the energy,
the pressure, the energy from the point of impact and the shoulder pad into the shoulder pad. Right. With all that padding, now the ballistic nature of the hit it can't take away from that. I mean, it was a violent hit.
Yeah.
But based on the data that I read anyway, I wonder if maybe there was another underlying cardiac condition that had been undiagnosed in Mr. Hamlin to make him more susceptible.
Yeah.
And there are other things that can make him more susceptible to a commotio cordis or a cardiac contusion sort of a scenario.
Right.
I wonder if there was something else going on there. And I think maybe as time goes on, maybe we'll learn more about some of these things and learn more about being able to protect other athletes.
Yeah. To your knowledge, has this ever happened in a pro football game?
I've never been a part of anything like this. I know there are situations, obviously, within baseball. There are, I think, there's older data, but I think in 2012 there were 216 documented cases of commotio cordis, but they believe that the diagnosis of commotio cordis is vastly underestimated.
Okay.
So, and there, I can't think of a situation in an NFL game where this had happened. Baseball's different. Hockey, there's been some, and I think obviously car accidents. And,
Sure.
I once I did have a patient at a facility that I used to work at, a level 1 trauma center. One of the patients I treated got hit in the chest with a soccer ball, and he had a pain that was really peculiar, and he came back again after we let him go home because he's only like 18 or 19.
Yeah, you're thinking he's fine.
He's fine, you know. He got hit in the chest with the soccer ball. Anyway, he ended up coming back again, and I don't remember how many times he came back, but he ended up going to the cath lab, and he actually had a congenital coronary artery aneurysm within the coronary blood vessels around the heart. He had a congenital problem that actually created basically like a heart attack in this kid. He had some heart damage because of the chest wall trauma irritating and doing something with the coronary arteries. Yeah, but anyway, he had a pre-existing condition. I wonder if maybe there's something else going on, and I think we'll learn about it, but obviously our thoughts and prayers go out to the Hamlin family, to every player on the Buffalo Bills, and the Cincinnati Bengals too. I mean,
the guy that I'm not even sure the guy's name that he was involved in the
number 85.
I'm sure he feels. I mean, certainly nothing he did wrong. Absolutely not. They're just playing the game, but I can't imagine. He's got to be. It's got to be tough.
My heart goes out to all the other NFL teams as well as they grieve one of their colleagues. There's a big community out there, and I know that this has really hit a lot of physicians hard too, who care for these injuries.
Sure.
But the positive side of this, I think, is it's going to make us even safer. And I'm sure that there'll be a lot of very smart people. And I hope that I can be part of something within our community here in Dallas to help us make these games safer. And just again, thoughts and prayers to the Hamlin family.
For sure.
Really, all the best for them. It's a tough time. So.
Absolutely. Well, that was super interesting. I was curious to get your perspective on what happened last night. Unique situation and certainly a unique perspective. So that was cool.
Very good. I think these sorts of situations create a lot of good dialogue.
Absolutely.
Always fun talking to you, Matt.
Yep. You too.
I love your perspective, and clearly I like to share mine. Put it on there.
Yeah. Sounds good. Well, we'll see you on the next one.
Be safe out there.